Laboratory professionals contribute to the health of our communities through their work in clinical and public health laboratories, and to patients in clinical settings. While some lab testing needs to be done at either Arnot Ogden Medical Center or Ira Davenport Memorial Hospital, others can be performed in an outpatient office.
When you go to the doctor's office and they do a rapid strap or they do a swab of your nose to test for COVID, influenza, RSV, that can be done at the outer offices because the laboratory has oversight and we provide the tools and the resources necessary for them to be successful.
After years of working on the bench, performing tests herself, Stephanie took on a different job in the lab.
I didn't think I would, but I really do love the quality role.
Part of her responsibilities include making sure the lab is up to New York State code at all times.
That the entire hospital is in regulatory compliance in regards to laboratory practices, transfusion practices, and that we're inspection ready at all times.
And another aspect is keeping communication with other areas of the hospital.
It does allow you to interact more with the departments in the hospital and try and bridge that communication gap with the different departments.
Bridging gaps helps the sample collection process run smoothly and keeps lab orders moving. When a sample is delivered to the lab,
we will look at different kinds of bodily specimens, looking for bacteria or viruses, depending upon what the physician wants us to look for.
For example,
if a patient has pneumonia, we will get a specimen of sputum and we will place it on what we call culture plates. They're designed to grow the bacteria. We'll take those plates and we'll put them in an incubator and the bacteria will grow on the plates. The next day, another technologist will examine those plates and based upon the characteristics of the bacteria that grow, determine if there are any pathogens present.
If there are pathogenic or disease-causing bacteria present,
we will test it against antibiotics to determine which is the best antibiotic for the patient to get to cure the infection.
Some tests take longer than others, but medical technologists can get test results for viruses like COVID relatively quickly.
The advances in virology are such that we can detect the presence of COVID in about 20 minutes. When I started my career, that would have taken days. And now the new technology allows us to do it within 20 minutes.
Barry doesn't read the cultures himself. Instead, he starts the puzzle for others to finish.
Very often, it starts with these stains that you might seen that we will look at these under the microscope. And based upon the microscopic appearance of the bacteria there, we give those folks one piece of the puzzle. But the physician will know within a few hours the direction that it's heading.
Without proof of what organism is present and those who can read and perform the culture, doctors would have a much harder time ruling out some illnesses, diseases, and disorders. For Arnot Health, I'm Lexi Cutmore.